Hi everyone, our group is going to present on the topic Alzheimer's disease. So first, these are the contents that we are going to discuss later on. And first of all, what is Alzheimer's disease? Actually, it is a neurological disorder that causes the brain to shrink and brain cells to die. So it will start from memory loss and difficulty to express their thoughts, and also drastic changes in their personalities and also behavior. So we can detect or diagnose the Alzheimer's disease through two different techniques, which includes non-imaging techniques and imaging techniques. Non-imaging techniques including clinical diagnosis and also mini mental state examination, while imaging techniques will include CT scan, PET scan, MRI, and also fMRI sub branches. And we decided to use fMRI to further our discussion because we noticed that fMRI is one of the best techniques that can detect the brain abnormalities and help to predict the Alzheimer's disease patient.
Resting state functional magnetic resonance imaging (RSfMRI) is a tool used to image and study the changes in the functional activities of different brain networks, and it is considered as a promising biomarker for Alzheimer's disease. Besides EEG, PET scan, CT scan, and so on, RSfMRI is one of the most widely used to detect Alzheimer's disease due to its safety, simple to use, non-invasive nature, and high spectral resolution. The common brain network used to detect the disease is default mode network (DMN). The decline of the frontal cortex area of patient, which can be observed through DMN, is reported to be diagnosed the Alzheimer's disease. Three methods to analyze the RSfMRI data, which are seat-based analysis (SBA), independent component analysis (ICA), and graph theory analysis (GTA). SBA requires to pick a seat before we apply, whereas ICA doesn't need, and GTA looks at the overall brain network structure with the specific spatial information when we apply it in diagnosis.
RSfMRI is using the interaction of proton with magnetic fields and radio waves to produce an image with the help of computer. Before the scan, patients need to tell if they have kidney disease or claustrophobic. They also need to wear gum and remove any metal objects. During the scan, they need to keep their head still. After that scanning, they can make an appointment with doctor and resume their daily activities. Among the sequences is RSfMRI. GE-API is most commonly used due to its better performance and medial temporal loop location. For the parameters of GE-API, the TR is 30 milliseconds, TE is 2000 milliseconds, FA is 90 degrees, and FOV is 250 millimeters.
When carrying out resting state fMRI, there are certain patient conditions and restrictions that we need to take note of. Firstly, fitness as in the body size and also weight. Just like a standard MRI, it has a weight limit of 159 kg and bore meter of 70 cm. So if a person is too big in size, he or she will not fit in the machine. Sometimes it's also a matter of geometry, like a person with a very wide shoulder. Secondly, allergic reaction. RSfMRI use resting state carbon dioxide fluctuations in the human brain as a natural occurring contrast, but sometimes gadolinium-based contrast agents are used to further enhance the blood oxygenation level dependent contrast, while research found that there are people who show adverse reaction to it, such as nausea, hives, and even chest tightness. Third, check whether the patient has chronic kidney disease. For G1 to G3, gadolinium-based contrast agent can be administered normally, while G4 and G5 and those who are undergoing dialysis treatment, gadolinium is best to be avoided because it may increase the risk of nephrogenic systemic fibrosis in patients with kidney problem.
Due to the structure of MRI, which is narrow and coffin-like tube, will easily induce the anxiety of patients since they need to lie in still for a long time. So it's better for physicians to inform patients about the conditions before the examinations. Besides, since MRI has strong magnetic field, the metal implant is an important issue that need to be considered before doing the scanning. The presence of metal implant not only will distort the image, they will also damage the surrounding tissue in the patient's body. Therefore, patients must inform doctor of any metal implant or the needs for thorough examination of the patient. The vibration generated by the strong magnetic field inside the MRI device will produce a loud noise, which may affect the patient's hearing. Therefore, during the scanning, the patients and operators are encouraged to have hearing protections to minimize the pain and discomfort.
So I'll continue with the drawback of RSfMRI and SMRI. RSfMRI is very sensitive to the hand motion, so it's quite hard to get the accurate result, especially for the patient who suffer from the severe Alzheimer's disease, and it is sensitive to the multi-scanner effect as well. The equipment cost and the maintenance fee is more expensive compared to other imaging technology, and it also consumes 10 times more of the time to resolve the neural activities compared to PET. For the SMRI, it lack of the molecule specificity because atrophy is not the Alzheimer's disease specific measure, and the image segmentation is time consuming compared to others due to its manual method, and it cannot directly detect the Alzheimer's disease histopathological hallmarks such as the amyloid plaque in the brain. That's all from our group. Thank you.